Hello, my dear future nursing officers. Welcome you all to the master nursing classes. In the last previous video, we have discussed the most important questions with concept with clear rationale. The clinical based questions I have explained in detail, in perfect, to penetrate in your mind and to retrieve in your exam. So, students, in this today's session also we are going to discuss those very important and high yield questions. There is highest chance of striking in your upcoming exams. So stay connected, watch the video till completely till the end. If you have any doubt, and do mention your doubts in the comment box. And who all are watching the master nursing classes first time, so please press the subscribe button and hit the like button. So we'll continue with our today's class. Good evening, beta. Very very good evening. Good evening. Good evening. Very very good evening. So I think many of you have already joined. So we'll start the class now with this very important and beautiful motivational quote for you all. Where there is a no struggle, there is no strength also. Students, if you are working on your dream, if you are working on your goal, and you are keep on striking your actions on your particular or weak areas, so definitely it will converts into your strong zone, and definitely the good result will comes. So if you are struggling, if you are actually working, so don't think about the result. It will be yours only. Yes, definitely it will be yours only. Right? So always have belief on your one's own potentiality. So that will definitely help you in your future, in your life. Right? So this is the very important lines for you people. And in the yesterday's class, I have given some assignment to you people. So many of you have commented correct answers. So I have taken one comment that's in detail for you guys. Okay. So the student name is here, the Niranjan Tegur. He given the correct answer for all the question. The red current jelly stool seen in the intussusception. So I asked the question where you will see the red current jelly stool. Yes, the red current jelly stool we will see in case of the intussusception. Okay. Then the strawberry color vagina. This question also I have asked to you people in the assignment. Okay, he given the correct answer, that is in the Trichomonas vaginalis. Okay, so in this particular infection, the strawberry color vagina will see. Okay, so then comes to the spoon-shaped nail in the iron deficiency anemia. Classically, you will see. So he given the all the three correct answer. Okay, so in the today's class also, you people will get some assignment, and you have to comment those answers in the comment box at the end of the class. So your comment will be taken for the next class, right? So many people have given the correct answer. So I have chosen the one. So it's not possible to show all the students' name here because it takes lots of time. So here we are giving the very importance for the time students, okay? Because the in the aspirant's life, time takes the priority for everything, right? So here is the beautiful plan we are having for your Norcet 9 test series. Okay, so if you are searching for the good questions, important questions, or questions with a clear rationale and all the updated and necessary questions, so here is the Norcet 9 Navagraha plan for you people. Here you will people will getting the daily one live test series. Okay, so the test is live from the morning 6 a.m. to the night 11 p.m. and at the 11:30 p.m. you people will get the all India rank. Okay, and weekly one booster class of the difficult topics. Here I am making those topics to be very easy and clear to you people. Okay, so then comes to the yes, the doubt solving session and 24 hour into 7 the chat box support will be there for you people to clear your doubts. Okay, so if you want to become a part of the Narset 9 Navagraha plan, so do download the master nursing classes app. Link I have given in the description box. Okay, so we will start today's class. Many of you have already joined to this session. So here is the first question in front of you people, right? The very simple and very, very important question. Which of the following is a classical picture of the crop? Classical picture of the crop. So what is the another name of the crop? So the another name of the crop is this is the respiratory inflammatory disease due to the infection. Okay, here larynx, trachea, and bronchi. So all these three get inflammation here. So we call this one as in the laryngio tracheo bronchitis. Okay. So the crop is another name of the crop is that is the laryngo tracheo bronchitis. Okay. So here the question is asking which of the following is a classical clinical picture of the crop? Option A. So that is the drooling and tripod position. Yes, in the last class, clearly I have explained where the child will try to assume the tripod position voluntarily. That is in case of the acute epiglottitis. In order to open the airway, like child will try to assume the tripod position. Okay, this will be seen in the epiglottitis. Okay, so very important. Then the option B comes here as in the barking and like barking like seal cough. Okay, so with harshness of the voice. So this is the classical picture of the crop. Okay, and many of you have given the correct answer. So that is the correct answer. So classical clinical picture of the crop is the seal like barking cough. It will comes and there is a harshness of the voice will be there because of the infection and inflammation of the larynx, trachea, and bronchi. Okay, so that's the most important thing, right? So the next very important golden point chanting on the crop is here. Okay, so crop the most common cause of the upper respiratory obstruction in the children's of the age group of the 6 months to the 3 years. Okay, so most common cause for the upper respiratory obstruction in the children's of the age group of the 6 months to the 3 years. Okay, so which is caused by the parainfluenza virus type 1. The most common cause of the crop is the parainfluenza virus and characterized by the barking shield like cough. Okay, and there is hoarseness of the voice and inspiratory stridor will be there due to the upper respiratory tract obstruction, right? So the next very important point is symptoms are worsen at the night. Okay, symptoms will increase and difficult to breathe to the child for at the night and may follows the viral upper load respiratory infections will be there. Okay, so then comes to the very important point next, there is a stipple sign. Stipple sign on the anterior posterior neck x-ray will be seen due to the subglottic narrowing below the glottis area, whatever the area is here. So that is the larynx, trachea, and bronchi. So it will be narrowed. So because of that, on the X-ray we'll see the stipple like sign like this, like this stipple on the church. So we will see that is the stipple like sign. So the stipple sign on the neck X-ray will be seen in the crop. Very important point. Okay, then when it comes to the treatment, yes. So here the treatment includes the cool and humidified air we need to give and dexamethasone to reduce the inflammation. That is the steroid and nebulizer with the epinephrine in order to open the airway. So these are the very important interventions. So heliox also we can give the here. Okay, that's the helium plus cool mixed oxygen. Okay, so that is also helps to open the airway, right? So all the golden point chanting we have done here. So then comes to the next important question for you here. So do read the question properly, perfectly, then try to throw your correct answer in the comment box. Yes. What is the primary mechanism by which salbutamol helps in the emergency treatment of the hyperkalemia? Sir, we have heard many times that the salbutamol is a nebulization where we will give through the nasal route in the lungs through the inhalation. First time we are hearing that, sir, the salbutamol is used to treat the hyperkalemia. Yes, in the emergency conditions to treat the hyperkalemia, we will use the salbutamol in the clinical area. So there is the highest chance of striking of this question will be there in your exams because this is used in emergency situations in the most of the clinical practices. Okay. Yes, in the some standard book also the salbutamol will be mentioned there. Okay. So what is the primary mechanism by which salbutamol helps in the emergency treatment of the hyperkalemia? So what is hyperkalemia? Hyperkalemia is the increased potassium level more than 5.1. Okay, that is what we call as the hyperkalemia. In order to treat the hyperkalemia, here we are using the salbutamol. How it works actually? Option A is telling that the increased renal excretion of the potassium. Bacho, if you want to excrete the potassium through the kidney or the renal system, you have to use the diuretics. Okay, you have to use the diuretics. So which diuretics is most effective? That is the injection furosemide, or in the clinical settings we used to call this one as the injection Lasix. Okay, so or we can say the injection furosemide also we can say here. Okay, so if you want to excrete the potassium through the renal, so that is the thing we are using. That one is the diuretics, that is the potassium, sorry, that is the injection Lasix or the furosemide. Then comes to the option B, blocks the potassium absorption in the gut. If you want to block the absorption of the potassium in the gut, you have to use the K binder, K binder powder. Okay, K binder powder will become, okay, it will be in the pocket. So we have to mix this powder with the water. Okay, we have to mix with this powder with the water. So then we have to ask the patient to take this powder mixed water. So when this K bonder, it will enter into the our GS system. It will binds the potassium and it will holds the potassium and it will excretes the potassium. Okay, so there is no absorption of the potassium is here. Okay, then comes to the option C, shifts the potassium into the cell via beta 2 adrenergic stimulation. Okay, students, whenever there is in the beta 2 adrenergic stimulation will be there, that time the sodium potassium pump will get activated. In this particular situation, the sodium from the intracellular cavity which will comes out, and the potassium which is there in the outside the cell, it will go inside the cell. So potassium is going from blood to inside the cell, means in the blood the potassium level will get decreases. So this is how it will treat the hyperkalemia, by shifting the potassium from the extracellular cavity to the intracellular cavity by the beta 2 adrenergic, by activating the sodium potassium pump. So this is the mechanism of action where the salbutamol works in order to treat the hyperkalemia. Okay, so this is the correct answer now, and many of you have given the perfect answer. So well done, beta. Here is the next very important question, and I'm waiting for your answers in the comment box. So do read the question carefully, perfectly, then try to give the best answer in the comment box. Yes, which of the following best describes the newborn during the first period of the reactivity? Listen here, the first basic thing. When the fetus, which will be living inside the abdomen of the mother in the uterus, it is having the very ideal environment, means the body temperature will be regulated by the amniotic fluid very clearly, and there is no any external force like sudden exposures to the air, sudden exposure to the light, sudden exposure to the noise, nothing will be there, because which will be everything will be handled by the maternal cavity there. Okay, whenever the fetus from the maternal womb, it will comes out into the external environment, it should be exposed to the, or it will be exposed to the room temperature, means there is sudden variation in the temperature is there, it will suddenly expose her to the air, so there is again sudden change in the environment is there, it will be sudden exposed to the light, there again the sudden change in the environment will be there. So from the intrauterine cavity to the extrauterine cavity, if the mother baby if the baby is coming, means it should be adapted. So this period we call as the transient period. Okay. So in this particular period, after the transient period, the baby will get adapted in three situations. One situation by the first period of the reactivity, second situation by the, yes, period of the decreased responsiveness, then the third situation by the second period of the reactivity. In these three periods, the baby will completely try to adapt from the intrauterine cavity to the extrauterine cavity. So this is what you call as the period of reactivity. How many phases are there? Three phases. One is first period of reactivity, second is the period of the decreased responsiveness, third one is the second period of the reactivity. So in the all these phases, the baby in one phase the baby will completely active alert, in another phase the baby will completely sleep rest and it will be like not active and alert, again in another period it will be again active and alert. So let me clearly give you a perfect concept so you people can able to handle the all kind of the questions which will be arises in your exam on the period of the reactivity. Okay, so the question is here is the very simple, which of the following is best describes the newborn first period of the reactivity. Okay, the first period of the reactivity, which of the following line which is best describing here? Okay, so option A, the deep sleep without low activity. In the deep sleep without low activity, this will be seen in the second, okay, stage, that is in the period of the decreased response units. Okay, so then comes to the minimal movement. This will be seen again in the second stage, that is in the period of the decreased responsiveness. Okay, so then the feeding is not encouraged. Again, this is in the period of the decreased responsiveness. Okay, so all these three statement will be seen in the second period. Okay, second stage, that is in the period of the decreased responsiveness. Okay, so in the first period of the reactivity, baby's heart rate will be somewhat high, and baby's respiration will be irregular, and the baby is completely alert and active. So here this is the perfect time to promote the breastfeeding. Okay, so that is what, if someone is asking when we need to start the breastfeeding in the baby, your first answer goes to the as soon as possible or within 30 minutes. If this both are not there in option, so within 1 hour. Okay, within 1 hour. So the first answer should be as soon as possible, or within 30 minutes, or within 1 hour. Okay, the first answer, second priority, third priority. Okay, so let me clearly explain you the period of reactivity. Okay, so here is the first period of the reactivity. Here in this one, the time frame is the from birth of the baby to the only 30 minutes after the birth. Here the baby is completely active, baby is completely alert. So that is what I am telling, we need to initiate the breastfeeding within 30 minutes. Okay, because after the birth the baby is completely active and alert, so it will be able to suck the breast very properly. So that is what the first answer goes to the as soon as possible, because the baby is completely active and alert in the first period of the reactivity, and the respiration here is the irregular, and the respiration will be the abdominal respiration will be normally there in the our what we can say, in the period of the reactivity. Okay, so then comes to the irregular respiration. As I told, there is the irregular abdominal respiration which will be normal. Okay, so then comes to the strong sucking reflex will be there. So that is what, it's an ideal time for the breastfeeding. Okay, so may or may not pass the meconium. Okay, not it's not necessary here to pass the meconium. If it is not passing also, not a problem. Okay, so till how much time we have to wait? So till 48 hours we have to wait. So within 48 hours the baby should pass the meconium. If the baby is unable to pass the meconium within 48 hours, so there may be a chance of the congenital anomalies of the anals or the rectus, or there may be a chance of the Hirschsprung's disease, or we can say the ganglionic megacolon. Okay, so yes, that is the very important point. Then comes to the second period of the sorry, then comes to the second stage, that is in the period of the decreased responsiveness. So in the second stage, it will last from the after the 30 minutes, okay, till the 2 hours after the birth. Okay, here the baby is completely sleepy, less responsive, and respiration becomes slower here. Okay, so then the more regular respiration will be there in the period of the decreased responsiveness. In the first period of the reactivity, there is a respiration is irregular respiration, but in the period of the decreased responsiveness, there is more regular respiration will be there. Okay, so then comes to the motor activity. Here there is a completely decreased motor activity because the child is sleepy here. Okay, so then the difficulty to arouse here in the period of the decreased responsiveness. Okay, this is also normal. Then the third stage, that is the a second period of the reactivity. Again, after the 2 hours the baby will awake. Okay, till the 2 to 8 hours after the birth. Okay, here the future, again the baby will comes alert, increased responsiveness will be increased, and increased muscle means mucus production will be there, and there may be a chance of the gag and regurgitate. Then comes to the possibly the baby will pass the meconium here, and urine also baby will pass here, and good time for again bonding and feeding here. Okay, so first best answer. Okay, where we have to promote the breastfeeding, so we have to promote the breastfeeding ideally. Okay, here in the first period of the reactivity within 30 minutes or as soon as possible. Okay, so one more important point, when the baby should pass the meconium, baby should pass the meconium within 48 hours. If the 48 hours is passed, still the baby is not passing the meconium, means there is chance of the problem with the anus or rectum congenitally. Okay, so the congenital anomalies we will need to identify, or we can say there is a chance of the ganglionic megacolon or the Hirschsprung's disease. That one we will discuss in the later classes. Okay, so hope it is clear to you people. This particular very important concept what I have explained is, this is highest chance to ask in your exam. Okay, so remember that one. Yes. Here is the next question. Do read the question properly, perfectly, then try to give the best answer. Yes. What is the normal axillary temperature range of the healthy newborn? What is the normal temperature in a healthy newborn? So question is very clear. In healthy newborn, the ideal site or the most common site of assessing the temperature in a newborn is the axillary root, because newborn, if you are checking orally, so there is chance of the yes, baby will not hold the thermometer in the mouth, one thing, and there is chance of the spillage of the mercury if the thermometer breaks, because the baby will be not cooperative. Okay, and the rectal thermometer, if you are inserting, means there is chance of the yes, vagus nerve induced bradycardia and another things. Okay, and if the without knowing the platelet count and without knowing the coagulation things of the baby, we are inserting the rectal thermometer, means there is chance of the bleeding is also there. So oral and rectal are not most commonly used. So the most commonly used route of the assessing the temperature in a newborn is the axillary route. Okay, so here what is the normal axillary temperature range of the healthy newborn? Option A, 34.5 to the 35.5. Option B, 35.5 to the 36.5. Option C, 36.5 to the 37.4. Then option D comes to the 38.0 to the 39.0. So what is the correct answer? The correct answer is here the 36.5 to the 37.4 degree Celsius, or we can say, just a second please. Okay, so there 36.5 to the 37.4 is the correct answer in the degree Celsius. Okay, so when we will come to the degree Fahrenheit, the 97.7 to the 99.5 degree Fahrenheit is the normal body temperature of the newborn. Okay, so almost all of you have given the correct answer. Okay, so along with this one, this chart is very important for your upcoming Norcet 9 exam. Okay, the hypothermia and stages of the hypothermia, because there is highest chance in the newborns, especially in the preterm newborns, to land of the baby into the hypothermia, because so in the intrauterine life, the baby, when there is there in the mother womb or in the amniotic fluid, the normally baby's temperature will be maintained by the temperature of the amniotic fluid. Okay, what is the normal temperature of the amniotic fluid? That is the 37 degree Celsius is the normal temperature of the amniotic fluid, where the baby can easily maintain the its own temperature. Okay, when the baby will comes into the extrauterine life, that room temperature will be low. Okay, like around 28 to 20, 22 to 28 degrees Celsius, around the normal room temperature will be there. So as compared to the intrauterine temperature, the room temperature is low. So that is the one reason, and due to sudden exposure to the air, sudden exposure to the external environment, there is chance of the sudden loss of the body temperature is there. So that is what you call as in the hypothermia. Okay, so the stages of the hypothermia here, the most important, and how to prevent hypothermia is also very important. Okay, so we will discuss the preventive measures of the hypothermia also. Okay, then comes to now the comes to the stages of the hypothermia. So the stages of the hypothermia is here: mild hypothermia. Here the temperature is 36 to the 36.4. So that is the mild hypothermia. So this mild hypothermia is we also call as the cold stress. Okay, what we can say this one as a cold stress also. Okay, so the moderate hypothermia is the 32 to what we can say 35.9 degrees Celsius, and severe hypothermia is below the 32 degrees Celsius. Okay, so there is less chance of asking the temperature in the Fahrenheit in the newborn. So still you people have to know. Okay, so below the 32 is the severe hypothermia, 32 to the 35.9 degrees Celsius is the moderate hypothermia, and 36.0 to the 36.4 is the mild hypothermia. Mild hypothermia is also called as the cold stress. Okay, so if you want the values in the Fahrenheit also, the values I have given here. Okay, so which is very important. Consider bocho, this chart is the a 10-star chart. Okay, very important. Then here is your assignment. Here is your assignment. The first referral unit, FRU, of the Indian healthcare delivery system. In the Indian healthcare delivery system, we'll study the health and wellness center. Now we call this one as in the Ayushman Arogya Mandir. Okay, then the primary health center, community health center, district hospitals. Okay, so among all these, which one is the first referral unit? So you have to mention your answer. Question number one, in front of that one, which one is the first referral unit? You have to mention in the comment box at the end of the class. Okay, so the second question is the Gobi Trivalya strategy used in which of the particular program? Whether it may be used in the GSSK, this is the GSSK, then RKSK, or we can say in the UNICEF, or you can say in the RBSK. So Gobi Trivalya strategy used in which of the following national programs? Okay, so this is also your question. You have to mention second question number second and the correct answer. Okay, so the third question is whether the Salk OPV is there, oral polio vaccine. So in the oral polio vaccine, we are having the two oral polio. One is Salk, another is the Sabin. Okay, so Salk is killed vaccine or the live vaccine. So this one also you have to mention in the comment box at the end of this class. Okay, so the assignment is clear. The first referral unit is which one? The Gobi triple F strategy used in which particular program, and the Salk OPV is the live vaccine or killed vaccine. So this is your assignment at the end of your class. Okay, so the next very important question is here. The principle of the growth and development that occurs from the center of the body and which moves outward is known as. Okay, so what happening here, there are the principles of the growth and development is there. Growth and development happens in the cephalocaudal and proximal distal, and which is continuous process. Okay, which depends on the hereditary, which depends on the genetic, and which depends on the integrated domains of the our own like cognitive and cognitive behaviors. Okay, so there are the lots of the principles of the growth and development is there, so I will discuss one by one. So now tell me where the growth and development happening from the center and to the outward. Okay, so what we call this one? Consider this is a baby. Here it is a baby. Okay, if the growth and development which is happening from the head towards the down means we call this one as in the cephalocaudal. Okay, from the up or from the head towards the down, so we call this one as in cephalocaudal. So here they are asking from the center towards the outward. Okay, so this is not our answer. Then comes to the option B, distaloproximal. From the periphery, distal means dur, means away from the body. Okay, proximal means center of the body. Okay, so here the distaloproximal means it is starting from the periphery of the body and which is coming towards the particular center of the body. So that is what we call the distal proximal. Okay, so here which is starting from the center and which is going away from the body, so that is what we call as the proximal or distal. So in the question also they have mentioned which is started from the center and going away from the body. So this particular principle of the growth and development, we call that one as in the yes, proximal distal. So the correct answer for this question goes to the option C. Okay, so our growth and development happens in proximal distal and in the cephalocaudal. Okay, so not distal or proximal. Okay, so yes, it happens general to the specific also. Okay, so the correct answer goes to the option C, goes to the correct answer, and many of you have given the proper answer for this particular question. Okay, so here are the principles of the growth and development. So the simple and very important words: growth and development is a continuous process. Okay, it will not stop by the night, it will not stop after having the food. Okay, so it is continuous process, it will be keep on growing in our life. Okay, so then comes to the growth and development happens in the sequence. Okay, so in the orderly and predictable pattern. Okay, so we can say, so the first teeth to erupt is like the lower central incisor, so we can predict so which teeth will develop first. Okay, so here the development is predictable. Okay, so like that, so it will be in the orderly or in the sequence. Okay, so then comes to the, it happens from the cephalocaudal direction. Yes, the direction of the growth and development, two types. One is from the head towards the down, so that is the cephalocaudal direction. Yes, Another one is from the center of the body to the away. So that is the proximal to distal direction. Okay. So it will happens in the two directions. Then it will happens from general to specific. Okay. So then the individual differs from inner rate. Okay. So yes, the Kalesh is and Malish, two peoples are there. Okay, the rate of the development and growth of the Kalesh is very different, and Malish is also different. Means the growth and development is not same to everyone. Okay, so the rate is different to the different people. So that is what one person is too height, one people is normal height, one people is like low. Okay, so that is what you call as in the rate of the growth and development differs from the okay one individual to the another individual. Okay, then comes to the influenced by the hereditary and genetic. Yes, their own whatever the characteristics they have brought from their parents, so that also matters in the growth and development, and which will be integrated with the or interrelated with the developmental domains. Okay, for example, if the cognitive domain of the baby is grown very fast, means the skills will be also will be grown, means one and another developments are interrelated. Okay, so that is the very important here. Okay, so all you people have to know the difference between what is the growth and development. Okay, very simple question. There may be a chance to ask in your question like KGMU and GMCH. So that's what I have brought this one. The growth is like we can measure. He is 160 centimeter height. He is 65 kg weight. So growth is we can say observable and growth is a measurable. Okay, but development is related to the function and skill and knowledge. Okay, so we can't assess and assess the skill. Okay, means we can't measure correctly. Okay, so that is the development. Here the growth is increase in the size, height, and weight. So that is the growth. And development is the yes improvement in the skills, improvement in the functions, improvement in the abilities. So that is what you call the development. And the growth is the quantitative. So we can say we can measure that one. Okay, the development is the qualitative, so we can't measure that one. Okay, so like emotional maturity. So emotional maturity, is it possible to measure? No, it's not possible to measure. But the weight, height, we can measure. So that is what the growth is measurable, development is not measurable. Growth is quantitative, the development is qualitative. Okay, so yes, the growth focuses only on the physical changes, but the development focuses overall, like physical, mental, emotional, every changes will be there in the development. Okay, so the time span is growth will stop after the a certain maturation period. Okay, so like if you have attained 50 years, then after that your height will be stop. Okay, so will not increase in your height after the 50 years also. Okay, so but the development will be continuous throughout the life, and it will end with the life. Okay, so that is the very important difference between the growth and development. There is a highest chance of the striking one question from here, so do remember and give your best shot in the exams. Okay, so then comes the next very important and basic question. Yes, a stage from the 1 month to the 1 year is called a stage from 1 month of the life to the 1 year of the life is called as. What is the correct answer? Option A, the neonatal period. Option B, the toddler period. Option C, the infancy period. And option D, the childhood period. So here in this particular question, we will see all the stages of the growth and development. Okay. So in detail, because one questions there may be a chance to ask in exams. Otherwise, there is chance to ask the applied question on this one. So both I will tell in detail. Okay, don't worry about that. Right. So now try to mention your answer in the comment box. I am waiting for your responses. Yes, the stage from the 1 month to the 1 year is called as option A, neonatal period. Option B, the toddler age. Option C, the infancy. Option D, the childhood. Okay, the stage from the 1 month of the life to the 1 year of the life. Here is your first option. That is the neonatal period. Option B, toddler stage. Option C, infancy. Option D, childhood period. So, what is your correct answer? Comment in the comment box. Yes. So, here is your entire details. There is the prenatal period, means the period before the baby born. Okay, that is what we call as the prenatal. Okay, natal means birth. Before the birth, that is the prenatal stage. Okay, so here the conception means when the sperm and ovum meets together and which forms the zygote, so that is called conception till the birth. So that is what we call the prenatal period. In the prenatal period, again three stages are there. Again, three stages are there. Okay, so that is the stage of the germinal stage, or we can say the mature ovum stage. That is the first 2 weeks of the life is called as the mature ovum stage or the germinal stage. Okay, so after the 2 weeks, from the 3 weeks to 8 weeks, so we call that one as in the embryonic stage. Okay, from the 3 to 8 weeks we call that one as the embryonic stage, and after the 8 weeks, from the 9 weeks to the till the birth of the baby, that is what we call as the fetal stage. Okay, so there are the three stages are there in the prenatal stages of the development. Okay, so very important and basic. Okay, so then comes to the second stage, that is the neonatal stage. Okay, so in the neonatal stage we are having the again two stages. Okay, so we are having again two stages. One is the early neonatal stage, another one is the late neonatal stage. Early neonatal stage starts from the 0 to the 7th day, okay, of the after birth. So that is what we call the early neonatal stage. Okay, so from the 7th day till the 28th day, okay, we can say till the 1 month. So that is what we call as in the late neonatal period. Okay, so very important. Then comes to the infancy, from the 1 month to the 1 year of the life. So that's what you call as the infancy period. So here is the your answer. That's the stage from the 1 month to the 1 year is called as, yes, the period of the infancy. Okay, from the 1 year to the 3 years, from the 1 years to the 3 years, we call that one as the toddler. Okay, so then there are the periods of the toddler. Okay, so in the early childhood, the 1 to 3 years is called as the toddlers, and 3 to 6 years is called as the preschoolers. Okay, and from the 6 to 12 years we can call this one as the middle childhood or the schoolers. Okay, so or we can say the school going childrens. Okay, so then comes to the adolescence. In the adolescence period, there is the 12 to 18 years for the girls and the 12 to 19 years from the for the boys. Students in the different book, they have given the different answer. So just you have to consider one answer, that is the 12 to 18 years is the adolescent girls, and 12 to 19 years is the adolescent boys. Okay, so then the comes to the adulthood. Okay, so in the early adulthood we are having the 20 to 40 years of the age group. In the middle adulthood, 40 to 65 years of the age group, and the late adulthood, which is more than 65 years of the age group. So these are the stages of the growth and development. Okay, very important for your upcoming exams, right? So all thing we have discussed on this one, and comes to the next very important question. Read the question properly, carefully. The hallmark feature of the bipolar second disorder. Okay, so here we have given the options. Here we have to choose the perfect answer from the all the given options here. Okay, which of the following is the hallmark feature of the bipolar second disorder? Students, we know the little bit about the dysthymic disorders, cyclothymic disorders, bipolar disorders, depressive disorders, manic disorders, right? So here they have asked the question on the bipolar second disorders. Means in the bipolar disorders, we used to study the two types of the disorder. The one is bipolar 1, another one is the bipolar 2. So among the bipolar 2, which one is having the hallmark, means the classical picture of the bipolar 2 disorder here. Okay, so option A is telling that the presence of the full manic episode. So this is what you call as in the only full manic episode is there. So that is what you call as in the mania. Okay, this is not in bipolar second. Okay, the presence of the psychosis during the hypomania, this is not in correct answer. Then option C, at least hypomanic and one major depressive episode. So this is what you call as in the a bipolar second disorder. Don't worry, I will tell the difference between the bipolar 1 and second, so you people will be very easily understand that one. Okay, so then the absence of the any mood disturbances, so that is not in correct answer. So correct answer for this question goes to the option C. Okay, so let me explain a bipolar disorder. Students, consider this one as in the a mood. Okay, if the mood is persistently low, so that is what you call as the depression. If the mood is persistently high, so that is called as the mania. Okay, if the depression is also there, mania is also there. So I call this one as in the bipolar. Means bi means two, polar means two poles. Okay, so bipolar mood disorder means there is a two poles are there in the mood. One is the depressive pole, another is the manic pole. Okay, so in the bipolar disorders we used to study the two. One is the bipolar first, another is the bipolar second. Okay, so in the bipolar first, so we used to study, consider this one is the mood. Okay, so here the period of the very severe mania is there, and the period of the very severe depression will be there. Severe period of the mania, severe period of the depression. Severe period of the mania, severe period of the depression. So severe period of the mania, severe period of the depression. This is what you call as the bipolar 1 disorder. Okay. So what happens in the bipolar 2 disorder? Here, consider again this one as a mood. Okay. So there is hypomania, means the mild mania, and severe depression. Mild mania, severe depression. Mild mania, severe depression. So this is what here we will see. We will see that one in the bipolar second. Okay. So look at this one. At least one hypomania, means mild mania and major depressive episode. This is what you call as in the bipolar 2. Okay. Hope it is very much clear to you people. Okay. So then what is the name of the disorder? Where we will see like this: mild mania, mild depression, mild mania, mild depression, mild mania, mild depression, mild mania, mild depression. So what is the name of this disorder? Do mention in the comment box. Here is the question on that one. Yes. What is the best describes the cyclothymic disorder? Option A, the chronic schizophrenia with mood swings. No. Option B, period of the full mania alternating with the major depression. This is the bipolar 1. Okay, so it is not cyclothymia. Then option C, chronic fluctuation of the mood involving the hypomanic and mild depressive episode. So what I told here, the mild mania, or that is the hypomania and mild depressive episode. So this is what we call as in the cyclothymia. Here is a cycle of the hypomania and mild depression, or the mild mania or mild depression. So this is what we call as in the cyclothymic mood disorder, or we can say the persistent mood disorder. Okay, very very important, right? So this is what we can say, there is the cyclothymic disorder. There is chronically fluctuating hypomania will be there and mild depressive episode will be there. So this is what we call as the cyclothymia. Hope it is clear to you people, right? So then comes to the third question here on the disorders of the mood. Okay, so what is the primary characteristics of the dysthymia? Okay, so what is the primary characteristics of the dysthymic disorder? That is the, we also call this one as the persistent depressive disorders. Okay, yes, option is the recurrent manic episode. No, this is not a correct answer. There is no any mania in the dysthymia. Okay, so only depression will be there in the dysthymia. Okay, so there is no any mania. Then comes to the long lasting but less severe depressive episode. Yes, we can say this one as in the correct answer. It's a long lasting, means for the long duration, but less severe means there is a mild depression only. Okay, so we can say then sudden onset of the severe depression is not a part of the dysthymia. If there is severe depression episode, so we call that one as the, we will not call that one as in the dysthymia. Okay, then comes to the option D, altering with the depression and mania. So this is also not our answer. So altering with the depression and mania, that is in the mild form means cyclothymia. Okay, so which is in the severe form means bipolar disorder. Okay, so that is not our correct answer. What happens in the dysthymic disorder? Consider this is the mode. Okay, for the chronic period, patient will be having the mild depression, then the normal mode, then mild depression, then the normal mode, then the mild depression. So this will be a what we call as the persistent depressive disorder, or we can say chronically patient will be having the mild depression episode only. Okay, so that is what we call as in the dysthymic disorder. Very very important for you people. It will strike in your exams. Among these four questions, one terminology will be important for you people in the particular very important upcoming Norcet exam or other exams like KGMU, GMCH and all. Okay, so hope it is clear to every one of you, right? So here is the next question waiting for your answer here. Yes, the question is very simple. Which psychosomatic treatment is often effective in severe melancholic depression, especially when medication is failed? Option A, the light therapy. Option B, cognitive behavioral therapy. Option C, electroconvulsive therapy. Option D, aversion therapy. So this is the very important question for your upcoming Norcet. Please try to mention your answer in the comment box right now. Yes. So which of the psychosomatic treatment modality? The word, the psychosomatic here stands as psycho means to something change in your mind. Somatic means on the body we are applying the things. Okay, so that is what we call as the psychosomatic. There are the treatment modalities. One is psycho-behavioral therapy, means where we are trying to change the behavior by using the some techniques. Okay, without injecting, without any applying the electrodes on the body. So just we are trying to modulate the patient behavior by using the techniques called as the aversion therapy. Okay, so then the what we can say the free association. Okay, everything. So that is what we call as the psycho-behavioral therapy. Okay, another one is the psychopharmacology. In the psychopharmacology, so we are giving the medications like antidepressants, anti-manic, mood stabilizers, okay, and antipsychotic medications, where we are using the medications to treat the psychiatric condition. That is what we call the psychopharmacological therapy. Okay, so here the psychosomatic therapy means here we are using the some devices and we will apply on the patient body to bring some changes in his brain by stimulating the production of the neurotransmitter or by stimulating the brain nerve cell activities. Okay, so that is what we call as the something we are applying on the soma of our body. Means soma means here is the body. Okay, something we are applying. So that is the psychosomatic or therapy. Okay, so which psychosomatic treatment is often effective in severe melancholic depression? In the severe melancholic depression, students, in the severe melancholic depression, the first and the best treatment is the antidepressants medications. When the medications fails, the next best treatment is the electroconvulsive therapy, and many of you have given the correct answer. That is the ECT we will use here. Okay, so light therapy we will use for the seasonal depression. Okay, so some patient will get depression due to the seasons like summer due to the some other situations, and some patients will like get into the depressions due to the situations in the life, like if some woman is she got pregnant means she will go into the depression, or if a woman who got like childbirth, or she is unable to handle the newborn means again she will go into the depression. That time for the mild depressions we can use the light therapy. Okay, for the seasonal depression and mild depressions we can use the light therapy. And cognitive behavioral therapy used in the like psycho uh, like what we can say in the psychosis conditions like schizophrenia and all, right? So aversion therapy is used for the things where like to avoid the alcoholism in the patients, and many situations are there. So I will discuss in the aversion therapy in detail. Okay, because it is very important. Okay, so then comes to the correct answer. What we have given is the psychosomatic. That is the electroconvulsive therapy is the best treatment after the failure of the medication in the severe melancholic depression. Okay, so very important. Okay, so hope it is very much clear to every one of you. Right, here is the next most important question is waiting for your answer. What is the most common type of the hallucination seen in alcohol intoxication? Focus on the word. I am not asking the question on the most common hallucination seen in the alcohol withdrawal. I am asking the question, yes, most common type of the hallucination seen in the alcohol intoxication, or we can say the alcohol overconsumption. What is the correct answer? Option A is the auditory hallucination. Option B is the visual hallucination. Option C comes here as the tactile hallucination, and option D is the olfactory hallucination. So what goes to the correct answer here? Mention your answer in the comment box. Fadafat. What is the most common type of the hallucination seen in the alcohol intoxication? Option A is the auditory hallucination. If someone asks you these three questions, so your answer will be a auditory hallucination. What are these three questions? The most common hallucination in the alcohol intoxication. So that is the auditory hallucination. Overall, most common type of the hallucination is the auditory hallucination, and most common hallucination in schizophrenia is your answer goes to the auditory hallucination. Bacho, a most common type of the hallucination in alcohol intoxication is the auditory hallucination. Then the overall most common type of the hallucination is the auditory hallucination. Most common hallucination in the schizophrenia is your auditory hallucination. Hope it is clear to you people. Then comes to the visual hallucination. This is the most common hallucination seen in a alcohol withdrawal, because in the alcohol withdrawal the patient will faces a like dementia. Okay, so because of that, there is a cloudiness in the consciousness. So in the alcohol withdrawal syndrome, yes. So because of the this particular chronic effect, okay, so the when the patient suddenly stop the alcohol consumption, then there is the sign symptoms of group of the sign symptoms will arises. Okay, so that is in that one the most common hallucination you people will see is the that is the visual hallucination. Okay, so then in the cocaine bug, okay, so the most common in the cocaine bug, or we can say in the cocaine overuse or the cocaine abuse, the most common type of the hallucination in the cocaine abuse is the tactile hallucination. Okay, here the person or the patient will complaints of formication. What is the formication? In this tactile hallucination, there is one word called as the formication. Here, the patient will complains something is crawling on my skin or under the skin. Okay, so like some insects are crawling on my skin or under my skin. So this is what we call the formication or the tactile hallucination. So which will be seen in the cocaine abuse. So that is what we call as the cocaine bug. Okay, so that will be in the tactile hallucination. Hope all the questions are clear on this particular question. Okay, very important. The most common overall hallucination is the auditory hallucination. Most common hallucination in the schizophrenia is the auditory hallucination. Most common hallucination in the alcohol intoxication is the auditory hallucination. And most common hallucination in the alcohol withdrawal is the visual hallucination. And most common hallucination in the cocaine abuse is the tactile hallucination. Hope it is clear to every one of you, right? So the next very important question is waiting for your response. So try to give your best answer here. Yes, the very simple and very important question. What is the hallmark feature of the Ganser syndrome? What is the hallmark feature of the Ganser syndrome? So the Ganser syndrome is also known as a syndrome of appropriate answer. Not appropriate, the syndrome of approximate answer. Okay, so it is also called as the syndrome of approximate answer. So what happens in the Ganser syndrome? Yes, beta option is the intentionally. Yes, this is intentionally faking of the illnesses for the personal gain. Okay, so that is the not our correct answer here. So this will goes to the another very important condition. So we will discuss this one in the next class very in detail. Okay, because it is very important. Okay, then comes to the repetitive unwanted thoughts and compulsion. Option C going the giving the approximate answer for the simple questions. Okay, so then the option D inability to recall the personal identity of the life story. So the answer goes here as the option C, the Ganser syndrome. Okay, so simply in order to explain in the simple way, if I ask you a question, yes, beta, please answer what is the 4 minus 3. So your answer will be yes. What is the 4 minus 3? Your answer will be 1, sir. Yes. So that is the person who will give the correct answer. Same this question I will ask to the patient with the Ganser syndrome. What is the answer for the 4 minus 3? The answer will tell yes, the 0.8. Yes, he will tell the answer, or he will, for even simple questions, he will tell the approximate answer. He will never ever tell the correct answer. Okay, so that is what we call as the Ganser syndrome. Or okay, also we call this one as the syndrome of the approximate answer. Okay, so hope it is clear to every one of you on the Ganser syndrome. Very simple and very important for your exams, right? So the next very important question is here, which of the following best describes the confabulation? So I'm waiting for your answer in the comment box. So fatafa do comment in the comment box. Which of the following best describes the confabulation? This word, the confabulation, the three questions came in the last Norcet 7 exams. Okay, so on only one word, that is the confabulation. Yes, which of the following best describes the confabulation? Option A, sudden loss of the uh, autobiographical memory. Okay, that is not a correct answer. Then the option C, B, the unconscious creation of the false memories to fill the memory gap. Yes, so that is what you call as in the yes, that is what you call as in the confabulation. Okay, so unconscious creation of the false memories to fill the memory gap. Okay, so what happens here? The patient is in conversation with you. Okay, so he is telling about his life story, and sudden some important fact he have missed here. Okay, so while telling his life story, there is a important event or there's for certain duration memory is not having. In order to fill this particular gap, the patient will create his one's own uh, false information, okay, or we can say the false memory to cover this gap in the memory. So that is what we call as the confabulation. Okay, confabulation is the filling the gap in the memories. So that is what we call as the confabulation. Hope it is very much clear to everyone of you, right? So yes, yes. So here is the next question waiting for your answer. Very important, very important next question, which is waiting for your answer. That is the deja vu is most accurately described as. What is the deja vu? In simple, the question is what is the deja vu? Option A, the hallucination is of the past event. Option B, the illusion that is new experience feels unfamiliar. Option C, the inability to recall the familiar places. Option D, a dream occurring while awakening. What is the correct answer? Yes, what is the deja vu? Deja vu is here in this particular situation. In the deja vu, the patient will be very much familiar to the unfamiliar thing. Okay, consider a patient who is going on the bike or the person who is going on the bike. Okay, so he will see the a DJ dance at the roadside, and suddenly he will go away from. Suddenly he will park the bike and he will go in the DJ and he will dance here. Okay, so he will dance here by holding the hands of the people who is dancing in the DJ. Okay, so whether he is don't know anyone in this particular DJ area, but the person is going and he is holding the hands of the people who is dancing there, and he started to dance. Means for the unfamiliar thing, he is acting like which is completely familiar to him. Okay, so that is what you call it on the deja vu. Okay, the new experience feels like completely familiar. Okay, so unfamiliar thing it is completely familiar to the a person. That is what you call the deja vu. Okay, so but the inability to recall the familiar thing means the familiar thing become unfamiliar. So that is what we call the jamaiso. Okay. So let me explain the all things on the deja vu and jamaiso. Okay. So in the deja vu, the meaning is already the patient will say the already seen. Okay. But here the unfamiliar things is very much familiar to the person. Okay. It's a false feeling that the current situation has the experienced before. Okay. The patient will say the he will go to the New York, or he will say that so I have came to the New York in the 10-year back, but he is first time visiting the New York. So now the patient will say it is familiar to me. I have seen the New York previously. Okay. So all unfamiliar things which seems like it is very familiar. So that is the deja vu. Okay. So it's an illusion of the familiarity, we can say. Okay. So in the jamaisu, what happens? Never seen. But patient will say the like the meaning of the jamaisu is the never seen. Person will go to his one's own home and he will say, so to whom home where I came, it is this home belongs to which person, or to whom which home this home belongs to. He will ask. Means the entirely familiar things of the person or the patient, he is acting like which is unfamiliar to him. Okay, so he will ask his one's own son, what is your name, beta? Yes, one's own son is very familiar to that particular person or that particular father, but here the father only asking to the son to tell the name of the baby. Okay, here he is completely acting for completely familiar thing become unfamiliar here. So that is what we call as the jamaiso. So these are very important points. That is the one jamaiso. Okay, so hope it is clear to every one of you. So today's session, I think you people have enjoyed a lot. Okay, so here we have seen the all the very important terminology like deja vu, jamaiso, confabulation, Ganser syndrome, alcohol intoxication, most common type of the hallucination, overall most common in the schizophrenia, in the cocaine bug. Okay, what is the psychosomatic, psychopharmacology, and psychoanalytical or the psychobehavioral therapy. Okay, so then we have seen the cyclothymia, dysthymia. Then we have seen the like bipolar 1, bipolar 2, mania. Okay, so then the all the developmental stages, prenatal developmental stages, postnatal developmental stages. Okay, so then what is growth, what is development, principle of the growth and development, and I have given the important assignment to you people. Okay, so that is the first referral unit. So what is the FRU in our India? So this is what you people have to comment in your comment box. Okay, so then go with the strategy of the which particular stage, okay, or sorry, which particular program. Then the salk op visa killed or live one. Okay, so by mentioning the number, you have to comment your answer. Okay, so then comes to the normal body temperature of the newborn and the stages of the hypothermia we have studied, and all three stages of the period of the reactivity we have seen. Okay, so then the use of the salbutamol in the treatment of the hypokalemia and all the golden point chanting on the croup means in a 1 hour we have studied near the yes 60 to 70 very important questions that is necessary for your upcoming exams. In detail I have explained with a perfect explanation and rationally. Hope you people have enjoyed the class, and if you want to learn the more thing, and if you want to practice the those very important and high yield question which is coming in your Norcet 9 exam, so if you want to become a part of that one, so do download the master nursing classes app. So I have given the link of the app in the description box and in the comment box. Okay, so after giving the answer for this assignment, so you people have to download the master nursing classes app and enroll the Norcet 9 Navagraha test series. Okay, so don't forget to mention the answer for your particular assignment. Okay, hope it is clear to every one of you. So we'll meet again. So tab tak ke liye jai hind, jai bharat. Keep on doing the struggle. Okay, the result will be definitely yours. So hope everyone enjoyed the class. So please share this class to your WhatsApp status to help us to grow us. Okay, so we will meet in the tomorrow's class again. Tab tak ke liye jai hind, jai bharat. Take care. Keep working hard for the better results. Thank you so much.